Jack. How are you? And I have been talking in the green room with our guest, and he's really doing a lot of great things for men. He really is.
Absolutely. We probably met 3 or 4 years ago, right, Greg?
Yeah, I'd say about 4 years ago when we first started talking.
And I mean, he's a master at what he does, and very helpful, very straightforward. A no nonsense guy. I mean, you would think he's from Pittsburgh the way he just doesn't mess around. He's a regular guy. So thank you for coming on, Greg. It's a real
I,
pleasure and honor to have you here on the Ultimate Men's Movement.
well, thank you so much. Thanks for the kind words for both of you. I appreciate it. And I guess there's some regular guys from Detroit too.
Oh yeah. Well, Erie and Detroit, we're on the same lake, same mistake, same lake, different mistake. I guess that's how
Exactly,
you'd say
exactly.
it. But yeah, now well, Neil's now in the Cleveland area, so we're all very close.
I got
Mhm.
you.
So so Greg, give us a little background on you, what you do, who you work for, why and how you've become such a maven in the men's health and ED treatment, testosterone. Give us a little bit of your background
Yep.
so the audience can understand.
So I am a clinical pharmacist by trade. I've been a pharmacist for over 35 years. And through compounding pharmacy really is where I guess I fell into my niche. It was a matter of being, I don't know if you call it being in the right place or just filling a void. There was a definite need for some consultative services and some real focused attention for men. And that developed into relationships with a lot of different urologists that I was working with, which, as I was explaining to Neil earlier, that led into my awareness of the need for a real comprehensive game plan for guys who've gone through or are going to go through any form of treatment for prostate cancer. So, several years ago, I designed and published a protocol, a treatment protocol for post prostatectomy penile rehab. Um, as we started using that around the country, then we got a little bit of attention, and our pharmacy was acquired by a larger group, which is called Revelation Pharma. Revelation Pharma is a network of 503A and 503B compounding pharmacies. I run Men's Health. So, they took me out of my humble beginnings, and now I'm over the pharmacies there. I do all the clinical work. I'm a clinical liaison. So I do outreach to all different types of clinics that have any relation whatsoever for men. So urology, men's clinics, functional medicine, concierge docs. In addition to that, I work with and for the BHRT Training Academy. I am one of their medical advisors as far as their men's health program. I authored their men's health module. Um, and again, I'm affiliated with a number of other companies around the country. I think it's one of those kind of things to me, and what I find the most advantageous part of what I do is I'm in a position where, so long as I listen to people, which I try very hard to be very mindful, I find opportunities and I find where there are areas of need. And that's, I think, what has allowed me to really do what I'm doing and, find the answers that guys need and avoid the fluff, just do the things that work and be a sounding board for men, because a lot of them, the ability to have someone that they can consult with, someone they can speak to on a ground floor level, not getting into a lot of real heavy duty science with them, explaining things and function and how I can benefit what they're going through. I think that's been probably the real highlight in terms of what's allowed me to be successful.
Do you see major differences across the country um, in awareness on mental and on men's mental health? I think there's guys, I'm just from my experience, being a blue collar guy, it's something that blue collar guys don't like talking about.
Right.
Any inkling of weakness or frailty, just buck it up and have another beer and just swallow your feelings like any good man should.
Yeah.
Um, but a lot of those guys, I mean, those guys really have my heart because they're the solid guys. They're the salt of the earth, the backbone. Um, and they often get left behind. They often don't seek help. And I just wonder if you see, different regions of the country, different demographics that may look at men's health in a different way.
What I've seen, and I really appreciate the question because number one thing is there's not enough awareness. And I think that we've come to a point where there a lot of the stigma has been removed. But to your exact point, when I start my lectures, when I do seminars or I'm in a speaking engagement, one of the first things that pops up on my presentation, it's actually definitions. And I'm pulling from, Webster's dictionary. So you look up erectile dysfunction and then you talk about and what's directly in there: impotence, weakness, frailty, abnormal. And you think in terms of this and you say, wow, how great is it if you're a guy and you're having some issues that you want help with, but when you actually look to see the definition of what's going on, it's basically saying you're abnormal and you're weak. And that's the furthest thing from the truth. Now, to your point, as far as the awareness and the openness, I hate to give these guys credit because I really am not a huge fan of their business platform or how they go about things. But these online companies that have emerged, the Hims, the Romans, the Rougiats, the Lemonades, they're in your face. They're in every social media platform. They're on television. They're on the radio. Everywhere you go, they're talking about this, which I think has allowed more openness in terms of the conversation because, you know, let's face it, I think we both predate Viagra. And, back before 1998, I don't really think ED existed because nobody talked about it. And
Right.
then, Viagra hit the market and all of a sudden everybody had ED, right? Well, in the same manner of thinking, I think a lot of these online things, just because they're so in your face and it's everywhere you look, I think it has allowed for a better level of communication and better awareness. And it's actually removed some of the stigma when talking with men. It used to be, hey, if it's blood pressure, if it's cancer, if it's arthritis, if I'm getting audited by the IRS, whatever, I'm going through a divorce, hey, we'll talk about that on the golf course. But if my junk ain't working, that's not going to be part of the conversation. I
Right.
think we've actually transitioned a little bit and we're getting into a realm now where that is now much more palatable in terms of being able to communicate.
Yeah, that's a great point, and you stimulated some memories of mine because I was in Japan in 1998, and I remember being at a dinner with a bunch of Japanese physicians, and there were some like little local celebrities there. It was kind of a big dinner, and this Japanese guy, he reaches into his pocket and he pulls out the little blue pill. He goes, "Have you guys seen this?" And that was like an awkward moment in a lot of ways. This guy's pulling, but I was in Japan. So,
Right.
when in Rome, when in Japan, so I was like, oh,
Exactly.
they're much more open about it. But you're right. It was a timing thing.
Yeah.
But to your point about, the online guys, one of my issues with it, because I use the men's clinic as an opportunity to introduce guys to other aspects of their health.
Exactly.
And I think that's I mean, first of all, I always say it's not the little head, it's the big, or it's not the little head that's the problem, it's the big head that's the
Right.
problem. Men get in their minds, they get in their egos, they're sensitive about frailty. And then it starts the cycle. And I think these online companies almost perpetuate and encourage this hidden, like I don't actually have to go see a
It's
doctor.
anonymous.
I can do it secretively. I can just get the pill that I need, that I want, but they don't necessarily know what they need or what
Right.
they want. So when I get guys coming in, they're like, so what can you do? What can I do for you? They're like, oh, I don't know. I'm just getting older. I just, I mean, they hem and haw around the
Door handle
conversation.
conversation.
Right. And then it's like, I'm like, okay, well, let's start. First of all, I mean, testosterone's a great place to start. I mean, I think there's just many proven benefits, both with the visceral fat, with heart health, bone health. There's so many good reasons for it, just to wake up the brain. And then you start talking, if you're going to be on testosterone, are you having any problem with erections? Then you get into the realm of ED treatment. And then you're like, well, then let's talk about that belly. Let's talk
Yep.
about what you eat. Let's talk about, are
Exactly.
you going to the gym?
Yep.
If we could give you a little more mojo with some testosterone, maybe you're going to have more interest in sex. Maybe you're going to want a little blue pill
Right.
to, help you
And you
out.
might not need that little blue pill anymore with testosterone. Sure,
Correct. I
Dr.
mean, so
Jack.
it's and diet and sleep and a lot of this goes back to the basics. And one of the things that really attracts me to the men's clinic is that it's wellness care. It's health, it's wellness. It's not let's just wait until the shit hits the fan and the wheels fall off and then go see a doctor to fix me
Right.
quick. So it's ongoing maintenance and I like that. Now let me like you're I think your biggest asset to the men's movement, your experience with ED treatment. Let's turn the conversation and focus on that a little bit. How would you, give us a little outline, a little, insight into your brain and how you think when you're talking ED, erectile dysfunction,
Yep.
what protocol goes into your head? What do you start with? How do you gauge patients and what they need?
Well, perfect. Gauging is exactly the word because what I do is I look at the whole person, number one. When I start dealing with a patient, I have a intake survey that I use. And it's if anyone's familiar with a SHIM test, a sexual health inventory for men. I've modified that for my own purposes to get a little more detail in terms of history and different things. But I really get into what's the background, what comorbidities exist, what therapies have been tried, what are the patient's goals, and
Right.
what are we looking at as the whole body. And just like what you said, I mean, there's guys that come to me and ED is primary, there's guys that come to me and energy and libido is primary, and there's guys that come to me and weight loss is primary. Those are not independent things. Those are all interrelated. So when we're talking to guys, number one thing is do that really in-depth intake evaluation on them because I call it the sexual function spectrum. And just like everybody else, everybody falls somewhere on that spectrum. Depending on how you're coming in the door, you may have really fairly decent function and maybe you need a nudge, maybe it's a confidence thing like you mentioned. Sometimes guys, they got to get right between their ears before they get right between their legs. So sometimes it's about giving them tools to make them feel better, to get their energy better, and to kind of give them a nudge in their function. And then you get into other guys where they have a little bit more developed history, disease has progressed further, maybe there's some more severe comorbidities, longstanding diabetes, blood pressure, surgery or injuries, where you're kind of tailoring that therapy based on how they're really being introduced to you. Where are they on the spectrum when you meet them? And
Hmm.
again, that does not ignore history. What have they done in the past? What's worked? What hasn't worked? So that we have a really good way of giving them a starting point. And that starting point will not be the same. It's not a one size fits all, which again, that's where my knock is with a lot of other clinics, a lot of these online things. Basically everybody's got, one size program for guys and you either fall in this or you don't. So being
And
able
it's
to really,
also it's also patient directed and not necessarily physician guided.
right,
People are calling and they're ordering
right,
things.
exactly.
I need a X, I need a Y. What is your qualification? What else have you tried?
Yeah.
Like you said, there's no evaluation. It's just a churn and burn. It's a way to, I think it's a good idea. Like you said, at least it raises awareness of
Right.
it in a non-judgmental way. So I think that's great. I've got no problems with it to see an erectile dysfunction commercial during a football game. Yeah,
Yeah.
whatever. But who are you? You're just going online and clicking?
Yeah. And again,
And then is it working? Is it not working? Are you doing
evaluation
it
is
right? Do you have
basically,
follow up?
yeah, the evaluation is basically it's evaluate by disqualification. So long as we're not doing something that's going to be contraindicated by medications that you're currently taking, we're good with it. Doesn't matter what else is going on systematically. Doesn't matter, functionally or metabolically what's happening with that patient. That's where we, and when I say that, I truly mean Ultimate Men, when we get into this picture and we're able to do this more in-depth treatment where we're looking at guys saying, hey, we're not looking at one aspect of your life.
Hmm.
My one of my big mottos is live harder. And yeah, I mean, I work with sexual function, so yeah, I get the joke, live harder, right? But really what that means is, for again, weight loss, for hormone optimization, for sexual function, go at life with vigor. Go at life and be aggressive. And everybody ages, but there's growing old and there's aging well.
Right.
So aging well and really taking advantage of what's available and the things that we can offer patients, that's where this difference is. And we are going to nail down, the ED treatments, the hormone treatments. There's so many options that we can put. And again, it's not one size fits all. So
Right.
we have the ability to design therapies that fit these guys. And some of them are going to fall into a number of these categories. So, hey, we are going to address weight loss. We are going to address hormone levels,
Hmm.
and then we can address sexual function, and they all will mesh together.
Right.
The
And the
interesting
other
and
thing
so,
that I find that I think,
uh,
I'm sorry, go ahead, Neil.
no,
Go ahead.
I'm gonna just jump on this real quick because it's making me think about this, Greg. I think where are we seeing, and when it comes to men and the just outrageously two different sides of the story, some that want to reverse aging. There's a big push for that now. Biohacking is
Yep.
huge, and it's not just younger men. Now it's people my age that are interested in that whole process and how that works. And then you have men that don't even care if they go to the doctor. We
Right.
have such extremes, and until we get hit right in the head, a lot of times if we have the extreme of not wanting to go to the doctor, I'm okay, I'm healthy, till something happens to us, we don't wake up.
What I think really happens is people just become passive. So I'm okay. I don't have to go to the doctor. Are they saying they don't care? Well, not really. They're just okay with the status quo. I'm getting older. So, yeah, I don't have energy. I don't have a sex drive. I can't go to the gym. I don't have the ability to have sex. They become passive and they accept this is just part of the process. Well, you can define aging, and one of the key elements is the decline in hormone production in our bodies for both men and women. So, when you talk about reversing age, or really what I talk about is longevity, because
Okay.
if we optimize hormone levels and we take advantage of things where, let's boost growth hormone production or release. Let's talk about optimization of hormone levels. Let's talk about optimization of sexual function. Now what we're doing is we're putting that same guy on this completely different page. So maybe the guy who is just, this is status quo, this is all, it's a lack of awareness. It's probably not that they just don't care. It's that we need to reach them and let them know, yeah, this isn't a movie star type of an appetite thing. This is for everyday guys where we can improve quality of life, we can improve longevity, we can really make, again, the aging process much less painful.
Yeah. I found it like today I had a great, the other thing, the parts of people's lives that you get pulled into, in my position, and especially when you start talking sexual function. But I had a patient today who came in, and he came in with his wife, which is not
Perfect.
unusual. Um, but men, when I see men in the orthopedic clinic, there's usually always a woman dragging them by the ear, bringing them in. Um, but then probably more likely, like men will come in by themselves, incognito. I don't want my wife or my girlfriend to know I'm here,
Yeah.
but, you know, um, but when they come in as a couple, I mean, it puts me in another realm, which is very healthy and very good.
Yep.
And I ended up talking to both of them about where to shop in the grocery store, what kinds of food to eat,
Mhm.
eliminating carbs, and then, when I asked, I said, well, we may want to consider testosterone. He goes, yeah, I'm sure I need it. I said, well, we'll check and we'll see. I said, but it's going to wake you up. It's going to, your brain is going to be clear, And I went to the wife. I'm like, are you ready to get him back? And she's like, oh, yeah. And, it's something that, when you have your woman there supporting you on top of it, saying, hey, it's okay. You're not who you're not the same guy you used to be when we were in the back of a 57 Chevy, but let's go. We can do this together. And I said, you guys can, go to a park after, later in the day and have more energy to do stuff. How would you like that? And she's like, that would be great. So it's nice when you see that it's not, it's not promiscuity. It's not,
No,
it's something that's just very necessary for a lot of people and a lot of couples that's missing in their lives and it's been missing. So it's nice to know that they can get it back.
and to piggyback off of that, again, I deal with guys who are really very progressed in the state of their disease condition. You get into some of these situations with post prostatectomy guys, and sometimes, unfortunately, I don't get them until 10 years after their procedure. What do we see in men who have the inability to perform up to their satisfaction? We see a withdrawal. We see men who, hey, if I can't finish the race, I'm not going to start. And by that, I'm talking about intimacy. I'm talking about, what happened to holding hands? What happened to kissing your wife? What happened to a back massage? What happened to going to a movie and, sitting almost on top of each other like we did when we were 14? When men can't perform, all of that gets shut down. So a lot of times when I'm getting these couples, and I love getting couples because I do a lot of intimacy work. I actually have a sexologist who works with me when we're doing these counseling sessions. But you know, we get to the point where you get the couple and like, well, I don't really care about sex. I don't really care about that. It's not important to me anymore.
Right.
Guess what? You're full of shit. Sorry, but you're full of shit. What you're saying is it has been off the table for so long that I don't consider it to be really a functional option in our relationship anymore. Let's get that back. Let's start
Yeah.
talking. Let's start touching. Let's give you the tools, both men and women, because
Right.
guess what? ED is, yeah, that's a guy thing, but vaginal atrophy, clitoral atrophy, low libido, painful intercourse, cystitis, boom, boom, boom. Guys, look at this. We've got on both sides of the table. So now let's have the conversation and let's get the bullshit out of the way because it is
Yeah.
important. It's
It's
vital to your relationship and your life.
Yeah, and
Right.
it's palpable when you're in the office and you feel the collective sigh of, oh, oh, we could do that.
Yeah.
And the range of products and pharmaceuticals that are available, anything from, if you want to start with beet juice and diet and some of those
Yep.
natural stimulants. But then let's go to, the little blue pill. You got your Viagra, you got sildenafil, tadalafil, vidalafil, and then you've got the apomorphine, you've got the oxytocin, it's bringing in the big head
Yep.
and not just the little head.
Right.
But then if you're at the point where you don't respond to those medications, then you're into the bimix, the trimix, the quad mix. And the beauty of those medications, I mean the trimix and those types of and this is a broad discussion today. We could go in a lot more finer tooth, but with someone who's on those trimix pharmaceuticals, it involves a needle, which makes people a little nervous, but it's painless.
Right.
They really don't feel it, and not you might, you will get an erection. There's a
Right.
way to dial it, for the overwhelming vast majority, even to the point when I first realized this, because I've done over my career, I've done a lot of work with spinal cord injury patients, and the paraplegics who, they're the ones with the still got the big muscles. They're still doing races, they're doing, they're potentially athletes. Um, but they cannot get an erection because
Right.
the brain and the part of the spinal cord that involves erection and orgasm um, has been cut off from the penis.
Yep.
But with the trimix solutions, even a patient with spinal cord injury can achieve an erection, because it happens locally, at the level. And that is, I mean, that's a great thing for, these wounded warriors. They go to way, they're in a nice relationship, they're married, they have a spinal cord injury, they come back home disabled.
Right.
Um, for them to be, for them, what a tragedy for him personally, for the wife, for the family, for the children. I mean, it's a global family.
Yeah.
It's a
Well,
sad story for everyone. But to be able to at least maintain that part of intimacy is a huge victory. And so whatever the spectrum of disease you're on, there are solutions for improvement, or at least talking about it, getting out there in the open, different
well,
techniques, you know.
Absolutely.
and I'm really glad you brought that particular point up because I've done a tremendous amount of work with guys with spinal cord injuries, a lot of military guys, and they show up and again, zero erectile function. Okay, so we're going to use penile injections, trimix, quad mix, bimix, so that we can achieve the erection. Well, guess what? Now they're erect, but they can't climax. So just like what you mentioned, now, okay, we've got the erection, you can have sex. Let's get you over the finish line. Again, oxytocin, apomorphine, even some of the CBD products. There are some great
Yeah.
cannabinoids that really benefit in terms of sexual function. So, we are able to get these guys from literally, and I'm not talking figurative, we're talking zero function to where now they have the ability to maintain an intimate life with their spouse and achieve not only erections but climax and really enjoy that quality of life.
Yeah,
Now,
the range, the range of pharmaceuticals and techniques you have are available. But once again, no one talks about these
Right.
things. No one talk, we're America. We're a bunch of Puritans,
Yeah.
We're not
exactly.
those
So
crazy
Dr. Jack,
Europeans.
what do you think would be your biggest final point to talk about with Greg today from what we've had in our
Yeah,
conversation?
I just like I said, we brush over a lot of these, and especially in, some of our early podcasts, we're doing broad stroke brush, we could go into, really detail about this, but I just think that, Greg's knowledge and, we're just brushing the subject here. Um, the bottom line is there's hope. There's hope in the end,
Yep.
that this isn't the point where, like you said, you become the grumpy old man because you don't want to be sensitive because you're just setting yourself up. If you start with the back massage, you start with the intimacy, closeness in any form,
Yep.
you're like, oh, I don't want to do this, it's not going to work out well. Why bother, why bother,
So
you know
shut it off.
right, so I'm
Yep.
going to be the grumpy old man, but
Yep.
that doesn't have to be that way.
Exactly.
There are many options out there that are very valuable for you and your spouse. It's like I always say, I think men, at least in my experience, men are giving people, I think. I'm not sure where all this bad talk about men comes from, but I think most of the guys I know, yeah, do you need help? I'll help you. You're stuck in a snowstorm in Detroit, and how many guys are out there pushing people out just for the
Yep.
fun of it? They could sit in the house, but they're outside shoveling and pushing people out because they like to help.
Right.
But they also like to help their spouse, their significant other. They want to make, things good for her as well. And this is an opportunity for you to do well for your significant other. It's not a selfish thing. It's a great thing. So, well, how do you want to finish up, Greg? What is your final message on this whole topic? Understanding that we could have you back again and go into more detail on things, but as a general message, what would you leave the public with?
I think what you said, I think hope is a great thing because, one of the things that I found early on working with, especially with the prostate cancer guys, so many of them before coming in for consultations would, they'd do the deep, dark dive down the Google rabbit hole and they'd come in with the worst prognosis, the worst information possible. And that drove me to not only develop my protocol, but my website, which penile that is literally nothing but resources for men so they can see there's hope. So when I talk to patients, what I want them to know is number one, this is intimate because we're going to have conversations that you don't have on the golf course and you don't have in the locker room. This is going to be man to man intimacy like you've never experienced it before. Number two, you're unique because there is no such thing as a one size fits all with what we're dealing with. Every one of these therapies, what we're going to do, we are customizing treatment to address your specific needs and your goals. And number three, there is really never going to be a no answer. There's going to be a next. what's the next step that we take? It's not, sorry, we're done. No, there's a next step that's going to be available, and we're just going to work through. I call it building block therapy, because we start at where you're walking in the door. We find you on the spectrum there, and then we start therapy, and we just add the layers until we really find the suitable message that you need. So again, it's about really delivering that care for the individual, letting them know that there's always hope, that there's answers available to them. We have the resources available. You know, Jack, with your clinic and with your knowledge, the way we can partner and help these guys, it's astronomical what we can do.
Absolutely. Okay.
And I appreciate all you're doing, Greg. And like I said, we've had dinner together, and steak and a beer, and you're a solid guy from start to finish. You're not only smart, you're compassionate, and you're purpose driven, and I love that. So thank you for sharing
Absolutely.
yourself with our crowd.
All
Thank
right.
you.
And Dr. Jack, we can check out Dr. Jack Rocco at theultimatemensclinic.com. Appreciate it, guys. Awesome stuff.
Thank
Thank
you.
you.
Make sure you like and share and subscribe to Dr. Jack's podcast, because trust me, you're getting information you're not going to find anywhere else.